Good evening, everyone. First of all, I would like to thank EVG Network and my upline for introducing Elite Career into my life. I'm Xiaoling. It's my privilege to be tonight's MC. I would like to thank all of you for taking your time to join us this evening. Before we begin, do mute your Zoom app to prevent any interruption to the meeting. Thank you for your cooperation. So later on, we will have a Q&A section. If you have any question, you can unmute to voice your question. But if you do not wish to on your mic, you may use the chat function to type in your question. There will be pictures displayed during the presentation. If you can't see it clearly, you may zoom in for a clearer view. Tonight's topic is regarding the difference between medicine, supplement, and food. Nowadays, the medical treatment is so advanced. A lot of people get medical treatment through Chinese and Western medical treatment. But do we really know the origin of medicine and the side effect? Do we really know how to differentiate between medicine, supplement, and food? Tonight, we have three speakers. Jia-En, Jasmine, and Lucas are going to share with us more about it. First of all, let us welcome our first speaker, Jia-En, to share with us regarding medicine. Let's welcome Jia-En.
Hello, good evening, everyone. I am Jia-En. So firstly, I would like to thank EV Global Network and my upline. So let us understand about medicine first. So how does medicine comes about? So in the 19th century, many women would fall ill and die shortly after giving birth. At that time, scientists have not discovered any drugs and doctors were not aware of the existence of bacteria. And during that time, doctors do not wash their hands when helping to deliver babies. That is why many women died due to bacterial infections. That is when scientists begin to develop antibiotics. So in the 1928, scientists have discovered the first antibiotic, penicillin. Until in 1942, it is then officially put in use. So what antibiotic does is to kill bacteria. In the US, tests are conducted on patients to confirm that the patient has a bacterial infection, and then the doctor will prescribe the antibiotic needed for the patient. So if the doctor prescribed wrongly, so their medical license will be revoked. But this practice is not common in Asia countries and not commonly used in Singapore. So many people do not have bacterial infections but are prescribed with antibiotic. This is actually a misuse of antibiotics. So with the misuse and overuse of antibiotic, it leads to another problem, antibiotic resistance. So what is antibiotic resistance? It happens when we take the antibiotic, but some of the bacteria in our body are not destroyed and continue to multiply. And after some time, it will start to attack our body again. So at this time, when we use the same antibiotic again, it will not work because the bacteria has become resistant to the antibiotic and cause the emergence of superbugs. And in most cases, diseases are actually not caused by bacteria, but commonly caused by viruses. So let's take a look at the common viruses we might have seen or heard before. So like SARS, H1N1, hepatitis B, hand, foot, mouth disease, HIV, Ebola virus, dengue fever, and even Zika virus. So most of the virus have a vaccine for it, but not all have a vaccine. So let's take a look at how vaccines are formed. So this is a picture of our body's B cell. So when the virus invades our body, the B cell in our body will start to react, producing these antibodies, which are in white in color, to fight these bacteria, viruses, and pathogens. And these B cells have a memory function as well. When we were to caught the same viruses or bacteria again, these memory B cells will be more efficient to destroy these viruses and bacteria. So how are vaccines made? So vaccines are made using weakened bacteria and viruses to trigger our immune system to produce antibodies, so which our body can then fight future infections caused by the same strain of viruses. So there are so many viruses out there, and some do not have vaccines developed. Hence, we can see that actually medical science is not able to catch up with the virus mutations. Thus, it is best to rely on our immune system, like our B cell, to do the job for us. So let's take a look at some of the drugs. So these are drugs for the autoimmune system. Autoimmune disease. So there is currently no cure for autoimmune disease, and some autoimmune diseases which are commonly seen are rheumatoid arthritis, psoriasis, and lupus. Sometimes doctor may prescribe steroids to help suppress the immune system to help relieve the symptoms. But these steroids comes with side effects like increased severity to infections and vulnerability to infections, and also increased risk of cancer, and also an overall general weakened immunity. So let's take a look at the drugs for chronic diseases, which are very common as well, like hypertension medications, cholesterol, diabetes, and hormonal-related medications. All these medications will only help alleviate symptoms and actually needs to be taken on a long-term basis. So for example, if I do not take the medicine, the symptoms will rebound again. So right now, there is currently no cure for these chronic diseases, and these medicine are actually only treating the symptoms. So what are some of the common medication we are being prescribed when we see the doctor? Like fever medicines help to reduce fever and stop pain, but it may cause destruction of the liver and kidney cells, and also leading to liver and kidney failure, and some even brain damage. And with fever medications, it is linked to about 450 deaths in the US every year. And the antibiotics, which I have mentioned earlier, it is to kill bacteria and treat bacterial infections, but it can also affect our immunity, and when misused, it can lead to bacterial resistance. And some side effects also like diarrhea, vomiting, and in bad cases, allergic shock, and even death. So sedatives are drugs to help to induce sleep, but it also comes with side effects as well, like short-term memory loss, breathing problems, and even addiction. Also, resistance to the medicine after a month, so it will not be as efficient and as before. So also the common painkillers which we see in the pharmacy, which helps to relieve pain, can also cause peptic ulcer, slow wound healing, liver damage, and in severe cases, it also affects the nervous system and also difficulty breathing. So we know that modern medicine can be classified into two big categories, medicine and surgery. So drugs can save lives in times of emergency. However, if it is misused, it can kill. So let us take a look at a short video showing Dr. Zhao Fei Chen, who is the authority of preventive science and the founder of nutritional immunology. And let's listen what she has to say about medicine.
Drugs cannot guarantee a cure. Drugs also give harmful side effects. Sometimes the side effect can be worse than the disease itself. Recently, it was reported that up to 98,000 people die annually from mistakes made in US hospitals. Many of these mistakes were wrong drug prescriptions. We must know that many diseases today don't have a cure. For example, SARS killed 900 people in 2003. Bird flu kills 3 in every 10 people infected. Why isn't there a cure for SARS or bird flu? SARS and bird flu viruses are mutated viruses. It is very difficult to find a drug that kills them. If a drug is found, when the virus mutates again, the drug might become useless. Even the common flu has no cure. Every year, up to 500,000 people die from flu. Flu drugs don't kill the flu virus. The drug only shortens symptoms by a day or 2. Think about the time you had a cold and a headache. The painkiller you took did not kill the virus, but still, you got better. How? During the SARS outbreak, some people died during treatment. Others on the same treatment survived. Some cancer patients live for years, although doctors tell them their days are numbered. How is this possible? It is not magic. It's not because of drugs. It is because of the person's immune system. The good news is that all of us have an immune system. In fact, With a little bit of help, we can use our immune system to prevent almost any disease in the world.
So through the video, I hope that all of you have a better understanding of medicines, and I will end my sharing over here. So let us welcome Jasmine to share with us more on supplements. So let's welcome here.
Okay, thank you, Jaren. Okay, so good evening, everyone. I'm Jasmine. So now let's move on to the supplement part. And so how does supplements come about? During the World War, there was the famine outbreak, and due to the lack of food, many people fell ill as they lacked basic nutrients for survival. And the common vitamin pills found in the market are vitamin A and C, D, and E. Like the vitamin A will cause the side effects like fatigue, osteoporosis, birth defects, and also lung cancer. And the vitamin C will cause the side effects like the kidney stones, as well as cancer. And the vitamin D will cause the fast heartbeat and erythema, while the vitamin E will cause the side effects like the osteoporosis and the prostate cancer as well. So what about minerals from the supplements? They cause the side effects as well, like the calcium is very familiar to us, right? While the BMJ British Medical Journal, they have conducted the trial, and the results shows that about 12,000 participants who took the calcium have increased the risk of myocardial infection by 30%. And also the folic acid, which is essential in the pregnant woman. But there is side effects to it as well, like the lung cancer, colorectal cancer, and also the prostate cancer. And the iron, also commonly found in the pharmacies, can also cause the side effects as well, like the constipation, nausea, vomiting, diarrhea, cancer, cardiovascular disease. Overdose can lead to death. So the glucosamine, we can see many glucosamine products, the supplements, right? And have you looked at the label on the bottle before? Many glucosamine sources are from the animal cartilage. For example, they are from the bovine and also from the shark. And the cells of shellfish and from crabs, lobster, and also shrimp. And all of them are made in the laboratory using the method of fermented corn as partial material, and which will cause side effects like breathing difficulties and also worsening the asthma. And the toxins accumulated in their bodies or on their cells is very harmful to the human body. And also the side effects is like the insulin resistance. It will increase the risk of developing diabetes. Okay, we also heard that the omega-3 are good for us, but omega-3 fatty acids from the animal sources like fish skin oil and also the cod liver oil supplements can actually increase the risk of the cardiovascular disease, and also will cause the marine pollution, and also causing these supplements may interfere with the effects of anticoagulants, aspirin, and blood pressure medications. And also, it can also cause diarrhea, indigestion, abdominal bloating, nausea, loose stools, rash, and nosebleeds. And besides, it's not environmentally friendly. And the probiotics from the dietary supplements and in the dairy products, the common source, the common bacteria added into it are Lactobacillus acidophilus, Lactobacillus rhamnosus, Lactobacillus gasseri, and Bifidobacterium bifidum. And the side effects are the allergic reactions such as breathing difficulties, hives, vomiting, diarrhea, and also coughing. The young, the elderly, and those with weakened immune systems should seek advice from a healthcare provider before using the probiotics. as they may induce potentially the fatal conditions. So the supplements also known as the alternative medicine. They do have the hidden dangers that we should be aware about. So for example, a vitamin C pill as compared with an orange, there's a limit on how much vitamin C pill I can take as the vitamin C pill is extracted and in pure form, and it can lead to some adverse side effects when overdosed. While for an orange, it has much more than just a vitamin C pill. Orange has minerals, fiber, and many vitamins in it. And no matter how much I consume it, there will be no side effects. Reliant, or take for example, today we are able to walk. But I choose to sit in a wheelchair for a couple of years. After a few years, am I able to walk again? The answer is no, right? Because my muscle will have degenerated. Same goes to the supplements as well. It will cause reliance to the body. Hence, the conclusion is supplement cannot be consumed daily. So now let's look at another short video by Dr. Chen on the views on supplements. Let me share the video.
Some people ask me, can you get all of these nutrients from a vitamin bottle? In order to be effective and well absorbed by the body, these nutrients must be obtained from wholesome plant foods. Yes, you might get antioxidant and multivitamins, but these are not natural antioxidants. They might have been extracted from plants, but isolating them makes them a chemical or a drug. Such chemicals can give toxic side effects. For example, beta-carotene or vitamin A is an antioxidant found in carrots. A study in Finland showed that smokers who took beta-carotene pills had more risk for lung cancer than smokers who didn't. But then, when we eat lots of carrots, we don't experience such toxic side effects.
Okay. Hopefully, the short video can give us more insights on the supplements. So we know that the medicines are not very good for us, and it needs to be taken under the supervision of doctor. And what can we take to improve our health? So let's have Lucas to share with us more on foods.
Okay, good evening, everyone. Okay, allow me to share my screen first. Okay, hold on. Okay, so as you can see, first of all, I'd like to actually thank EVG Network as well as my upline. Allow me to introduce myself. My name is Lucas. Thank you, Jia and Jasmine, for sharing on medicine and supplement. Today, I'll be sharing with you about food. So first of all, let's take a look at this slide. I have a question here. Are humans meant to eat meat or plants? Well, here's a clue. Looking at our teeth structure, does our teeth look like a lion or a horse? So let's analyze the teeth structure between a herbivore and a carnivore. A herbivore is a plant-eating animal, like the horse, have sharp front teeth to chew the plants and grass, while a carnivore, a meat-eating animal, has sharp front and canine teeth to tear meat apart. So how about their intestines actually? You know, a herbivore intestine is about 3 times its body length, while a carnivore intestine is 3 times the body length. Plant-eating animals have longer intestine to allow enough time for absorption of nutrients, as plant food needs time to be broken down due to the large amount of fiber. Whereas for carnivores, it has a shorter intestinal tract to allow meat to pass through quickly, as raw meat contains bacteria. Research also has shown that humans evolved around 250,000 years ago from an ape like our ancestors. So in summary, it turns out humans are herbivores, so it is recommended for us humans to eat more fruits and vegetables. When it comes to plant food, not all plant food is safe for consumption. Plant foods are categorized into categories. So, firstly, will be medicinal. So, plant foods that are medicinal in nature comes with side effect, and overdose can lead to serious side effect as well. Many Western medicines are extracted from TCM, such as, firstly, aspirin, which is a painkiller that is extracted from white willow bark, which can cause stomach bleeding. Whereas for digoxin, which is a drug for arrhythmia, which is extracted from Digitalis, which can cause heart disease. In addition, there are some plants such as ephedra, tobacco, which, have you ever heard of it? No, some people also use marijuana to actually relieve pain, but they are addictive. It can be fatal if used in large amounts. Functional plant foods are wholesome plant foods like vegetables, fruits, and whole grains. These are foods suitable for all ages, as no matter how much you consume, there will be no side effects. So now I'll be sharing on the various nutrients in food. The first one will be protein, which is essential for our body cells renewal. So normally, where do we get our protein from? From meat, usually from milk, meat, eggs, right? So all these are animal proteins, which are high in fats, cholesterol, animal hormones, and calories. Increase the risk of osteoporosis. It is difficult to digest and absorb. And children who grow up drinking milk get allergy easily. Animal protein burden and damage the liver and kidneys. No, babies need protein too, right? So the first choice will be definitely breast milk. If not, the second choice will be soy milk, which is free of fats, cholesterol, animal hormones, and low in calories, easier to digest and absorb, and does not burden the health. In plant food, soy is the best source of protein. It has 2 times more protein than milk, 3 times more than eggs, and 12 times more than milk. Soy also has anti-cancer effect as it inhibits the growth of cancer cells and tumors. Soy helps to prevent cardiovascular diseases, which reduces cholesterol and prevent osteoporosis by enhancing calcium absorption and retention. It stabilizes blood sugar levels as soy has low GI index of 18. Soy is a good choice if you want to maintain good shape. It also helps in weight management, as it helps to speed up fat decomposition and inhibit body fat formation. Next will be fiber. Do you know that fiber is very important in our diet? This is because we need fiber to flush out the toxin in the body. The recommended daily intake will be 20 to 35 grams, which is equivalent to 10 unpeeled apples. Insufficient fiber will cause constipation and in long-term colon cancer. Now, let us take a look at psyllium husk. It is very rich in fiber. Out of 100 grams of psyllium husk, 71 grams is soluble fiber, which is 7 times more than oats. So let us take a look at the benefits of soluble and insoluble fiber. Firstly, soluble fiber, it actually forms a protective layer in the intestine, blocking absorption of fats, cholesterol, calories, and prevent cardiovascular diseases and control weight. Insoluble fiber is a natural laxative, removing toxin from intestines, prevent constipation and cancer. Lastly, maintain a radiant skin. Next will be phytochemicals, one of the disease-fighting nutrients. So why do we need this? This is because it actually combat our modern diet and lifestyles, as our daily diet is difficult to avoid animal protein like meat and seafood, as animal proteins are high in calories and cholesterol, which is not ideal for our body. Negative emotions like stress and anxiety will cause our body to secrete a toxin hormone called corticosteroids, which will suppress our immune system up to 80% within 30 minutes. Furthermore, many food contains food chemicals like MSG, colorings, and preservatives. This will affect the normal functioning of our immune system. Therefore, we will need phytochemicals in our diet to combat these problems. So an example will be cattle. Cactus has more than 10,000 phytochemicals, which strengthen the immune system, a cancer fighter and neutralize cancer-causing hormones, strong in anti-inflammation, prevent cardiovascular diseases. So the next disease-fighting nutrient is antioxidant. So why do we need this actually? Free radicals are produced in our body when we are exposed to air pollution, toxic fumes, high heat cooking, UV rays, unhealthy diet, and our body's metabolism process. These free radicals interfere with the stability of our cells' DNA, causing damage, leading to cancer. Hence, we need antioxidant to destroy free radicals. Rose is also rich in antioxidant to prevent DNA damage. I believe that many people want to look younger than their age, and rose has 50 times more than vitamin C than lemon, which enhance the body ability to produce collagen, which in turn also improve skin texture and lighten pigmentation. Rose also helps to relieve feminine problems such as period cramps, irregular menstruation cycle, and combat cold. Cactus fruit also has 7 times more antioxidant than vitamin C. It actually promotes cell repair and renewal, improves skin softness, aid in wound healing, both inside and skin surface as well. Next, blueberry is also rich in antioxidants to support heart and liver health by reducing the buildup of bad cholesterol, whereby prevent cardiovascular diseases and inhibits the growth of liver cells by 50%. Blueberry protect brain cells, improve memory. Many people nowadays spend more periods staring at computer screens and phones, and blueberry can help to improve vision, also prevent urinary tract infection. The third disease-fighting nutrient is polysaccharides. Let us take a look at our environment. We are constantly exposed to radiation from our laptops to even TVs. And the constant virus mutation from SARS, H1N1 to now COVID-19. Despite the advancement on medical science, it is unable to catch up with the virus mutation. And lastly, our daily necessity products contain cancer-causing agents such as SLS, triclosan fluoride, lead, and mercury. Hence, we'll need polysaccharides to combat these problems. So one of the examples will be Cordyceps mycelium. It's rich in polysaccharides. It is a powerful anti-cancer effect. It actually regulates immune system, which can improve both immune and autoimmune disorders, strengthen heart, lung, liver, and kidney functions, increase energy, vitality, and the resistance to stress. Also, a variety of mushrooms like ABM, maitake, and shiitake mushrooms are rich in polysaccharides, which enhance the immune function and recharge immune system. The high amount of polysaccharides aids the production of cancer-fighting cells and suppress tumor growth, preventing the reproduction, spread, and relapse of cancer cells. Also prevent viruses and harmful agents from entering delicate tissues. It also treat and prevent AIDS, chronic diseases, obesity, viral infections, poor blood circulation, stomach upset, and exhaustion. All elite products are formulated wholesome food based on nutritional immunology, where they take further steps looking into 6 criteria. Firstly, type of selection, parts extraction, time of harvest, ingredient nutrients combination, strict and advanced processing techniques, and lastly, safety tests. So types of selection, Cordyceps mycelium, out of 400 species, only 10 have nutritional values. With the correct selection of the species, it can help to protect lung and kidney functions, reduce phlegm, cure cold, and difficulties in swallowing. So next will be parts extraction. So the example will be cactus. The sharp spine of the cactus must be removed, followed by its thick skin, as it cannot be absorbed by the human body and may cause indigestion. However, its gel has the highest nutritional value that is more than 10,000 phytochemicals. With the correct parts extraction, it can boost immunity, prevent cancer, anti-inflammation, aids in wound healing, and neutralize toxic hormones in the body. Next will be ginseng. It's most nutritious in the roots. So thirdly, the time of harvest is also very important. You know that plants are harvested when the natural value, nutritional value is the highest. So example will be ginseng, whereby it age around 6 to 8 years, have the highest level of ginsenosides. With the correct harvesting, it helps the body to adapt to stressful conditions, reduce fatigue, improve memory, improve oxygen levels in the body. Next, nutritional immunology also take into consideration about ingredients, nutrients combination, as the right combination of the ingredients can further enhance the benefits of each ingredient and bring synergy. Cactus is full of vitality where they can survive for 400 years. With the combination of American ginseng and cactus, it can increase the productivity of our body cells. So, elite products have to go through strict and advanced processing techniques. So one of the techniques is actually high purity filtration. Example, cactus. Side note first, before the nutrients reaches to the consumers, it must be harvested as early as possible during the day, as the acidity is the lowest at that time. Excessive heat may reduce the nutrient content and degrade fiber content as well. So after removing the spines and skin, the gel must undergo particle filtration, microfiltration, and ultrafiltration. Such high purified filtration process can filter very small particles such as bacteria that are 0.01 to 100 microns in size before it's clean and safe to consume. Another technique will be spray drying. This method is an ideal method which requires certain temperature to eliminate the toxin. Example, soy, which has mild toxin. So in order to remove the toxin, the skin and seed, it requires a heat of 60 to 65 degrees. Next will be freeze drying. It actually can retain the nutrients and maintain wholesomeness. A sliced strawberry requires 14 to 16 hours to freeze dry, while a strawberry takes 3 to 4 days. Rapid freeze the plant food at the required temperature. It actually removes most of the moisture and retaining up to 1 to 4% moisture, long shelf life without preservatives, and quickly reconstitute after adding water. So the last criteria will be safety tests. Many plants have been contaminated by the environment, soil, and water sources. So organic does not mean it's safe unless it can pass the following safety tests, such as heavy metal, microorganism, pesticide, and poison tests. Elite has manufacturing facility in Singapore. It is awarded the Food Safety Excellence Award Gold by AVA, which is now currently called the SFA, where it is graded A for 15 consecutive years. After sharing on the many benefits of food, the miracle cure is right there in the supermarkets. There is all the fruits and vegetables. Elite Global products are just a convenience for everyone at all ages. Nutritional immunology advocates that prevention is always better than cure. Of course, we need to partner with these 4 factors to achieve a healthy body. There is sufficient sleep, moderate exercise, maintain positive emotion, and correct, pure and well-balanced nutrient to have a healthy body. Through our sharing, I'm sure that now you have a clearer view on the difference between medicine, supplement, and food, and how to choose correct health food, where you can share this knowledge with your families and friends. With this, I end my sharing over here. Thank you. So I will pass the time back to the MC.
Thank you so much for the 3 speakers sharing. Through the first speaker, Jaan sharing. Actually, most people know that medicine can help us to ease the sickness and reduce the suffering. Medicine is used during emergency. It can save life, but it also can make us lose our life. Thus, using medicine must under doctor's supervision. As listen to our second speaker, Jasmine sharing, we understand that supplement has side effect due to supplement is produced through chemical process and is not wholesome. Overdose will have side effect. Thus, supplement can be used for daily consumption. Through third speakers, Lucas sharing, We learned that we need to consume wholesome food that from phytochemicals, antioxidant, and polysaccharides to improve and strengthen our immune system to fight against the diseases. Have anyone tried nutritional immunologist food that win back their health? The answer is definitely yes. Xingji will share about her mom's testimonial on how she recovers from acute liver failure and broken left arm bone testimony. Let's welcome Xingji. Let's give her an applause.
Thank you, MC. Hi, everyone. I'm Xingji. I'd like to share with you my mom's testimonial. My mom had acute liver failure in July 2015 and was admitted to Kuantan General Hospital. Let me show you her test results. Give me a moment. Yeah, so her test results were very bad. You can see a lot of high and low. Yeah, so her liver function test showed that her liver damage level, ALT and AST, surpassed 1,000, which were 1,093 and 1,661, a very severe level of liver damage, as the normal range for healthy person should be less than 56 for ALT and between 5 to 34 for AST. So at that time, my mom was bedridden and also suffered from whole body water retention. Also had jaundice or skin yellowing and was in pain most of the time. Her kidney function were affected as well. And her urine was cloudy and dark brown in color. My mom's blood sugar level was very high, which was around 14. The worst part was that the doctor told us that there was no treatment for my mom and asked us to prepare for the worst case scenario. That means family members, relatives, and close friends should come to see my mom before it's too late. To me, it sounds like a death penalty to my mom. As I understand very well the science of nutritional immunology, I let my mom consume nutritional immunology products, and within 4 days, her ALT and AST level improved tremendously. You can see from the report on the bottom, the level reduced to half. ALT was 712 and AST level was 564. So she continued to take products. Her kidney function had improved as well. Because of the improvement, the doctor prescribed medication for improving kidney function. However, this medication had caused water retention in her lungs. The doctor also suggested a liver transplant for my mom, but this was not a good option due to my mom's age, which was 74 years old at that time and considered quite old for a transplant. And medical checkup reports would need to take 3 weeks to see my mom's eligibility for the liver transplant. This had not included the matching of liver stability. Luckily, my mom continued to take products and her liver and kidneys condition improved greatly. Her lungs had improved as well. So 3 weeks later, her ALT and AST level had returned to normal, which were 28 and 47 respectively. So from the previous liver damage level that surpassed 1,000 back to normal values in just about 1 month time. This was very amazing. With these great results, my mom was discharged from the hospital. Her recovery process back at home had been in ease with taking products and supports from my family members and relatives. In 3 months' time, she is able to walk with support. Her follow-up appointments has been reduced from weekly to once every 3 months. Her medications had reduced from 5 types to only 1 type. In 6 months' time, she gained back her self-care ability. The follow-up appointments was reduced to bi-yearly instead. Her subsequent medical appointments follow-up in July 2016 show her liver's function and kidneys functions are back to normal. Now her medical follow-up appointments is on yearly basis. We were of great relief and truly grateful that my mom had completely recovered from liver disease. My mom continued to take nutritional immunology products for health maintenance. However, on 26 December 2019, my mom's left lower arm bone was broken because she fell down. Her injured arm was very painful. Left hand was swollen and stiff, making it very difficult for her to take bath, wear her clothes, prepare meals, do daily chores. Okay, her normal daily activities were badly affected. She needed help from someone even for wearing pants. So at that time, she also felt very tired. So at that moment, she was taking a complete nourishment series, which consists of Rhapsody, Rosy Thyme, Soy Green, Berry Beet, Raisin Tree, and Immunity. And she increased the amount of Rhapsody by taking 1 small box a day. So as a result, she felt that the pain had reduced very much. Through taking a complete nourishment series and accompanied by treatment from traditional Chinese medicine, my mom's arm recovered very fast. The pain and the swollen, stiff left hand has eased. 1 month later, through X-ray, the doctor confirmed that my mom's arm had recovered very well. We were so happy and relieved to hear that. My mom's arm condition continued to improve, and her self-care ability and daily routine has returned to normal since then. So my mom's left arm has completely recovered. She continues to love to take Rhapsody, Rosy Thyme, Immunity, and Raisin Tree for health maintenance. She takes complete nourishment series for 3 months on a yearly basis. So this is my mom's recent photo. So it is really a blessing to have nutritional immunology knowledge and Elite Wholesome products for my family and myself for prevention and gaining back our health. I shall end my sharing here. Thank you.
Thank you, Shinjit, for her sharing on her mom. Through consuming nutritional immunologist product and adjust her mom lifestyle, her mom wins back her health. Let's congratulate her mom again. Please take note that disclaimer. Every product is specially formulated to nourish the overall body, including our immune system. However, our products are not in any way a form of medications or drug and should not be used or to treat or cure illnesses. Next section will be our Q&A section. Believe that the sharing just now, you may have some questions to ask. You may unmute to ask the questions or type in your question in the chat box. Let me check, is there any question in the chat box? I saw there is a questions in the chat group. There is so much health information out there. How are we able to distinguish what is right or wrong? Thank you, this friend, for the questions. I repeat the question. There is so much health information out there. How are we able to distinguish what is right or wrong? A very good question. Is there anyone from the Q&A community who can help to answer this question?
Hi, Xiaoling. Yeah, my name is Charlie. I will help to address this question. Thank you.
Thank you, Charlie.
In fact, actually, I love this question very much because my friend always asks me, so Charlie, there's so much information on the internet. So how do you actually differentiate what is right, what is wrong? So this problem actually become more rampant ever since my uncle Google was born. You can find any answers, right, just by asking my uncle. But then the big question is how to know whether the information is true or false. Okay, so firstly, right, you have to look at the sources that are reputable. Okay, you want to look at all these big health agencies. Okay, for example, let's say today, if you are browsing Facebook, YouTube, or Instagram, or any other social media, okay, then you came across news article like take multivitamins and magically improve your health, or you take collagen supplement and have youthful skin and make your wrinkles disappear. So when you see this kind of information, right, you have to take it with a grain of salt, because it doesn't matter, right? Okay, if that's the health claim or anything else. Okay, you want to actually double and check your sources and think a little bit more why this information is making this kind of claim. Okay, so are there any reputable health agency that will support this claim? Then you might want to ask, can I see the original research that is saying all of this claim, right? So even though, right, there's a lot of articles, media articles or journal articles, they are based on legitimate research. Okay, many a times, right, this research itself has been grossly misinterpreted by the journalist in question. So I'll give an example. Okay, there was a research, right, that was making rounds a while ago. And I remember very clearly it's because it was a very good example of how this research was grossly misinterpreted. Okay, so this article, right, was saying that milk or dairy products doesn't cause heart disease. Now, if you're a layman like me or layman like a lot of people, right, if you see this kind of heading, right, what would you think? You say, see, I can take as much dairy product and I won't have any health issue. I will start to indulge a lot of this kind of dairy product without any concern. Okay, so let's come back to this research, right? And actually, this research was done on the Maasai tribe in Africa. Okay, now this tribe, right, the only food that they eat are dairy products. Okay, what happened is that none of them are fat and none of them have heart disease. So the journalists, they look at this and say, they came out, dairy products don't cause heart disease. Okay, but then the problem is that these journalists, right, they left out the very important part, which is this Maasai tribe runs about 40 kilometers a day just for their survival. Now let's look back. If you were to run 40 kilometers a day, you can eat as much dairy products as they do, and you're not going to get heart disease. But let's say, but if you're like the average person like me, who spend a lot of time sitting in front of computers, or being a couch potato, and then you start indulging yourself on dairy products, then you might have some issues out there. Okay, so when you see articles like this or research like that, okay, you might want to look at the original source and be able to make your own judgment. Okay, just let me show some slides. Okay, and also you also want to know, right, who is saying this. For example, the CDC, all right, Center for Disease Control and Prevention, okay, in America, okay, NHS in England, or is it the World Health Organization, or is it the FDA? Then after, then what sort of journal it is published in? For example, is it published in the BMJ or the Lancet? Okay, is it published in all these things in the Lancet? Okay, then after that, how was their research done? Okay, and also, is their methodology good? Okay, how did they pick the people to do the research? Okay, so all this information can be kind of complicated. So for most people, right, okay, all you need to do, right, is to make sure that your sources are coming from someone that you trust. Okay, plus, right, you also have to use a little bit of common sense. All right, that's where the common sense comes in. Okay, don't just believe everything that you read, especially coming from the internet. So I hope my answers, right, address your question. And with this, I end my sharing. Thank you.
Thank you so much for Charlie's answer. I hope Charlie's answer can help this friend. Let me see if there has any more question. There is no more question. We will end the Q&A session now.